Hello, hello, hello. Welcome, everyone. Thank you for joining us for Pediatrics and the Pandemic. This is Dr. Donna and a lot of my superstar, superhero friends. We are going to have fun tonight. And that's probably a word you haven't heard in a while. But there are a few superpowers that pediatricians have. And one of them is fun, no matter what. So that is our intention. We are going to be sharing information with you about how to parent during a pandemic. It's our intention for a few things. One, for this to be as uplifting as possible. We know that there's a lot going on. People are tense, they are stressed. Even though everyone is staying at home, we hope that doesn't mean for parents that you necessarily have more free time. It may mean you have less free time. Your children are needing more, children of all ages, from infants to young adults. And so we are here to share some practical information with you. Now, we know there's a lot of technical information out there and a lot of people are probably inundated with that. So tonight our format is going to be something that we think will be easy for you, gentle for you. We're sharing pearls of wisdom, practical pearls. Because one of the things we know is when you're stressed, it can be tough to retain all this information. When you're parents, a lot of times you try to get it right. So the last thing we want is to add to any feelings of overwhelm that you have. How does that sound? If that sounds good, put some comments in the chat box. Let us know that you're ready. Let us know where you're coming from, what part of the country, what part of the world. I'm going to introduce all of our wonderful panel, and then as they each do their presentation, they're going to share more information about themselves. We have Dr. Pam, who's a holistic pediatrician. She's going to be sharing information about general peds issues and questions that you may have, because even though the world is focused on all things pandemic, we know that life keeps happening, and you may still have some general questions about what to do with regular pediatric stuff. We have Dr. Ebony, who's a developmental pediatrician. She's going to be sharing some pearls of wisdom about how to function in this abnormal new normal that we all have. We have Dr. Yvette, who's an emergency medicine specialist and physician. She's going to talk to you about emergency medicine and things that you may need to know or would be helpful for you to know if you end up there or you're considering whether or not to take your child there. We have Dr. Janine, who's a pediatric hospitalist, which means she specializes in taking care of pediatric patients, infants through teens, who have been hospitalized. And she's going to share information about that, about if hopefully you won't end up there, but if you do or it might happen, what you need to know. And then we have Dr. Anila, my accountability partner, so we got a special connection. She's an obstetrician gynecologist, and she's going to share very important information for all the moms to be, because in the midst of all things that are going on, life keeps happening. So there's really a lot of information that will be important for you to know if you are expecting now. And then she also has some other information to help you be conscious about your family planning during this time. So, are you ready to get started? Does that sound good?
Sounds
You
good.
have housekeeping issues. If you have things during this, there's a Q&A box. If you're watching this on your laptop, the Q&A box will be at the bottom. So please type your questions in there. If you're watching on your phone or tablet, you may have to scroll to see the Q&A box. And so please put your questions there. That'll make it easier for us to keep track. We can type them. If you get confused and you can't find that, feel free to put them in the chat box too, and we'll be monitoring all of them. Throughout the presentation, we're going to be sharing a few tips, and we will probably give you some links to websites. Don't worry, don't stress. If we mention a resource, we'll email it out to you afterwards. So do your best to sit back, exhale, enjoy, consume this information. So let's get started. Sound good? You ready? If you're ready to get started, let's put something in the chat box. So as I mentioned, I am Dr. Donna. I started out my career as a community pediatrician. Then I transitioned into a trauma-informed well-being specialist. Now I help adults who are super achievers move from stuck to unstoppable so they can function at their best in mind, body, spirit, and life. So to get this going, I'm going to share a couple of pearls that are practical and probably speak to where a lot of you are now and why you're on this call. So the first pearl is for you to remember that you set the tone in your home. Your children, and actually a lot of the adults you interact with, are going to follow your lead mentally, emotionally, energetically. So that's why it's important for you to, just like we always say, when you're on a plane, put on your oxygen mask first. During this time, it's very important for you to make your self-care and your emotional well-being a top priority. Because if you feel calm in the midst of all this uncertainty, your children will learn that from you. You will model it for them. And depending on their age, you can actively teach them. So easier said than done sometimes, I know. So here's one tip that we're going to share with you. It's one of my all-time favorite calming mechanisms. It's a breath technique. It's very easy to do. I will say, I know for some people, depending on their trauma history, sometimes breath work, it doesn't resonate well with them. This is a technique that tends to be safe for all people, everyone, because it's a physiologic response. We're going to teach you how to get your body out of stress response and into the relaxation response. But if you know that sometimes breath work can feel uncomfortable in your body, monitor yourself and adapt accordingly. Many of you may know this as belly breathing. It's called diaphragmatic breathing medically, and it's very simple. Inhale slowly through your nose. If you can inhale fully, maybe to a count of 4 comfortably, do that. So inhale slowly and imagine pulling all that air all the way down to the bottom of your lungs till your belly pushes out, almost like you're filling up a balloon. So, and then you want to exhale fully to the count of 4 or whatever is comfortable for you. So let's try that together again if you haven't already been doing it. Inhale, 2, 3, 4. Exhale through your mouth, 2, 3, 4. And what this does, and you just repeat it till it feels comfortable. What this does is it helps stretch a muscle or the diaphragm. I'm not going to get too technical, but what it does is it helps your nervous system kick in from the nerve that helps you calm everything. So it really helps you physically shift. Also, when you focus on your breath, it can become a mindfulness technique. So you can get a lot of benefits very, very quickly. That's your first pearl. Pay attention. Remember, you set the tone for your children and for the other adults in your house. So if you're feeling fearful, anxious, do something to calm and to shift. The next pearl I'm going to share is to recognize that this is a traumatic time for literally just about everyone in the world, and a lot of people are grieving, and that includes children. Sometimes we don't think that children grieve, especially younger children, but they do. And grief doesn't necessarily happen only if there's a loss of life. There are different levels of grieving. There are a lot, say for example, if you have teenagers who are like their school year was cut short, they don't have prom, they may not be having graduation. Younger kids may have, this is recital season, they have been working really hard for dance recitals or to do the lead in the play. So these are some things as adults we may not think about, but there may be different levels of grief because these are things that are lost and they're not going to get it back. So the pearl is to recognize that there's a lot of trauma and grief going on, and to be gentle with and patient with yourself, your children, and everyone else. So with that, I'm going to transition. I want to, here's, I'm going to do it now. I was going to save it to the end, but I'm going to offer this to you because we're talking about self-care for parents. Remember, we're teaching you pediatric pearls, but you can't give from an empty cup. So the gift I want to share with you is a self-care guide, because again, now so many people are overwhelmed. You might want to take care of yourself, but sometimes figuring out what to do is a chore. So if you go to manifestexcellence.com/choose you, I put together a very simple, easy to read list. Pick your favorite 1 or 2 things to do on there, and that is what you can do to help nourish yourself. Again, remember pearl number 2, be gentle with yourself as well as your children and others. So with that, now we're going to transition to Dr. Ebony, who's going to share wonderful information about what we're going to do with this abnormally new normal that we have. Dr. Ebony.
Perfect. Thank you. Hi, guys. I'm so excited that y'all are all here. I'm Dr. Ebony. I am a board certified developmental and behaviorally and confidently. I also help parents to support their child's development and help them reach their personal developmental and behavioral potential. So pearl number 1, ensure that your child has a predictable, but just bear with me. What I mean is that, you know, if you can keep bedtime, mealtime, outdoor time as consistent as possible, that really helps children feel centered. It helps them feel safe in a time where lots of things don't feel very certain and there's a lot of anxiety. Their routines, well, really everybody's routines, but kids aren't going to school. They're not able to see their friends. Everything has changed so much. So if there are things that we can keep the same, that can be predictable for them, it's going to be so helpful. One of the things that a lot of parents are asking me about is developmental and behavioral regression. That means going back on a skill, forgetting how to do something, and keeping a steady routine is the best way to prevent that. Just for a little TMI, my own little one, the first week we were home, he had to take a step back. I called his teacher at school. He goes to daycare typically. And then I just had him sit at the times he was doing at school. Because the way we did it at home was very different than how he was doing it at school, even though he was dry at home too. So I just ask you to kind of look at what's going on and just kind of investigate and try to get things as consistent as possible. And you'll see that your child will be able to keep those skills up, keep the developmental progress going. In terms of the behavior, when things are not predictable, you're just more likely to see undesirable behaviors, for lack of a better term, increased tantrums, irritability, etc. You see better behavior when kids feel safe and when they know what to expect. And so that's pearl number 1. Pearl number 2, having open, honest communication. You know what? This is scary. It is unnerving, and the easiest thing to do would be not to talk about it. But to avoid talking about it actually makes kids more anxious and more worried. They're hearing about it. Everybody's talking about it. People are walking around in masks. You can't avoid it, or you shouldn't avoid it. And so that being said, keep open communication. If your kids ask you a question, answer it. You know, do it in a way that they can understand. Try not to do it when you're super anxious yourself. Try to take a minute, give yourself a mommy time out to get yourself calm, and then answer the question. Because as Dr. Donna said, you know, we can get super anxious and our kids feed off of that. So if we are calm and centered, you know, our kids are more likely to be calm and centered. The other thing I want to say is we don't want to offer too much complex information. Let's not talk about, you know, infection transmission and germs and viral, you know, all this stuff. They may not understand that, and it may be overwhelming to them. And the other thing is if you don't talk about it with your kids, they're gonna get it from social media. They're gonna hear it from other places, and you're more likely to provide accurate and reassuring information than anyone else. And when you are open with your kids, you're leaving that line of communication open, and they will talk to you, and you want to have that trust there, and communication is one of the best ways to ensure that. And then the other thing I want to say is just be sure that you focus on what you are doing as a family to stay safe. You know, you can explain that we are washing our hands, we are staying in as much as possible, because concentrating on what you are doing can help kids not feel so scared. It can make them feel empowered even. And so for pearl number 3, manage expectations for yourself and for your children. Okay, let me say that again. Manage expectations for yourself and your children. Do not expect yourself to be rock star homeschool parent the first day. You might be. I was not. You might be. But anyway, give yourself grace. This is not the time to try to be perfect. We are all out here trying to do our best, and give yourself grace is what I'll say. A lot of us were working outside of the home, and now we're home. We have to know that these are big adjustments, and it takes some time to really try to adjust and adapt to the new normal. And so, when you think about it and be conscious to think about it, offer that extra hug, offer that extra cuddle. It's going to go a long way. So that being said, I did put together a list of resources for you that you can go to that include some educational developmental activities for your kids, how to talk to your kids about coronavirus, etc. And you can find that by going to drebonysgift.com. That's DREBONISGIFT.com. Thank you.
Thank you, Dr. Ebony. Thank you so much. Wonderful information, important pearls. And even though we haven't specifically talked about being age appropriate with your children, what we're sharing really does translate across the spectrum. Sometimes with younger kids, we think that, oh, they don't know. They know. They can see kids, even pre-verbal kids, they can see and sense. They know that they are seeing people in masks. They maybe can't communicate that, but they know they're seeing things that are different. Definitely teenagers are going to see and hear stuff online. But these days, even 4 or 5 year old, because they may not be online, but they may be interacting with grandparents or cousins or older siblings. So we want to be age appropriate with as we're interacting and applying all of these. These are wonderful tips. Summarizing again, be predictable and reliable, whatever that looks like to you. We may need to shift it. That was a wonderful tip around, even though you may have had a routine before, now that you're at home all the time with your child, that routine is different from school. We want to do that. Definitely be open and honest with your communication. That's an ongoing skill as parents we have to develop. That's the world of parenting. There's a plethora of uncomfortable topics. In the old days, it was things like sex. Now it's pandemics and, why are people like looking so afraid? But either way, we always want to be open with our kids and age appropriate. And then managing expectations. That's so important for yourself and for your children. We don't want you to get into pandemic parenting perfection. Don't do that to yourself and don't do that to your kids. Remember, one of the pearls I shared, be gentle and be patient. Next, we are going to go to Dr. Pam. Thank you, Dr. Pam. What goodies do you have for us?
Okay, so hi there. I'm Dr. Pam Middleton, your virtual holistic pediatrician. Through my books, online course, and telemedicine services, I help families achieve and maintain health and wellness through inside out healing. So the first pearl that I would like to share with you guys is call your child's pediatrician if you have any questions, because I know that right now you're being told, don't go into the pediatrician's office. The office might be closed. Don't go to the ER. Don't go to the urgent care. But we're still here for you. You're not like out there by yourself trying to figure out, oh, is my child too sick? What should I do? Your pediatrician is still available to you. So call the office and they will let you know what to do. In some cases, pediatricians are just doing telemedicine visits. There are other pediatricians that are doing a combination. So if they feel like they need to see your child, they will have you come in, or they can actually, tell you where you need to go. So let's say that your child is having COVID-19 symptoms and you're concerned, like, do they need testing? Well, your pediatrician will know what's going on in your particular community. They'll be able to guide you to where you need to go, whether there's a testing facility available or whether, as I'm sure you'll hear about later, in some cases, they're only going to test you if you're, eligible for hospital admission. So those are things, remember, to still call your pediatrician if you need to. And if your child has just accidents, I mean, kids are still going to have accidents. Kids are still going to have the regular sicknesses. So if any of this happens, when in doubt, always call your pediatrician. And if it's really bad, call 911. Okay? So, pearl number 2, be creative when encouraging your children to perform ongoing hygienic activities, like washing their hands or coughing, in their sleeves. Because with the hand washing, of course, you're being told, wash your hands, wash your hands. So, kids aren't going to remember to do that. So you have to make it fun. Like, you could, have them go wash their hands, maybe sing something like, row, row, row your boat 2 or 3 times, or whatever. Maybe every day you can change the song so that you guys are saying, today, this is the song we're going to sing when we're washing our hands. And ever so often, have them wash their hands. So, don't just have them wash their hands like right before they're eating, but have them wash their hands at other times, like maybe even every hour. Say, hey, it's time for hand washing, and make it fun. And also when it comes to, like coughing into their arm, you can make that fun too. Come up with some little fun thing like, oh, pretend you are the magician, with the special cape, and oh, now you're gonna cough, stuff like that. So just make it fun for them. And, and then that way it won't be so hard for them to do it. And they may even remember to do it a little bit more than you're telling them when you make it fun. All right. And then pearl number 3, use safe, age-appropriate treatment for symptoms. And this can be for any type of symptoms. Like, I'll kind of run through some general things that you can use, for the general, like we're still kind of in cold and flu season. So your child may have some symptoms that you think are COVID symptoms. This just a cold or just their allergies. So the big thing that parents are always concerned about, fever. For fever, remember, a fever is your friend sometimes, most times. Unless your child's truly lethargic, not responding to you, if they can still respond to you and, they're up, they can, they may not want to do a lot. But I always say for parents, if your child is acting the way you would act if you had a temperature of like 102, they're probably okay. Because, you would want to lay around, wouldn't really want to eat a lot. You probably drink something, but you just don't want to be bothered. You can go on and, and just have them do like an Epsom salt bath, or have them do some homeopathic meds for that. A few other things for a cough, you can give honey if they're over a year of age. For nasal congestion, you can do saline drops. I really like Exclair. You can do a saline rinse or a neti pot. You can do homeopathic meds. You can do homeopathic meds for just about all of this stuff, okay? But the main thing I want you to remember is that children under 6 should not be using over-the-counter cough and cold medicines, okay? So don't give them the over-the-counter cough and cold medicines, but they can have homeopathic meds. And that's the end of my pearls. But because I just kind of touched upon the homeopathic meds a little bit, and you guys are probably like, what? What's that? What homeopathic meds? I have a gift for you. So if you can go to www.drpam.gift, you will get some tips for things that I think parents should have at home. And there are some homeopathic remedies in there, and I even will explain to you how to use them. And I will also make sure that you get a special pandemic action guide for pediatrics that's going to have all of this stuff in it. Okay, that's it.
Fantastic. Thank you, Dr. Pam. We have more people joining us. So we have 36 people on so far. So thank you, thank you, thank you. If you're just joining us, first, welcome. Second, the format we're using tonight is keeping this as easy to digest as possible. There's so much technical information and it's important, don't get me wrong. There's a lot of important technical information that's out there these days. Our intention tonight is to give you practical, easy to digest, easy to remember information. Hence, we are giving you pearls of wisdom. We encourage you to take notes, but if that's too much for you, pick one or two items. If you remember one or two items from tonight, you are ahead of where you were before you came on. So Dr. Pam just gave us some wonderful pediatric pearls regarding general ped stuff, because right now the world is so focused on pandemics, but we know that life is still going on. So common things are still common. Parents may still have questions. Kids still are active. Some of them may still be injured. And so we wanted you to have some general information. The biggest, well, they're all important. The first thing she shared was call your pediatrician. This is not the time for you to feel like you're out there alone. Staying home doesn't mean that you are alone. It means you may have to alter what you normally would do. So call your pediatrician, and then he or she can advise you on what to do. Come in, have a telemedicine consult, go to the emergency room. Of course, when in doubt, if you think it's life-threatening, call 911. So that's what the first pearl. Next is be creative. We do want our children to always have hygiene habits. Now, more than other times, it's very, very important. So that's why it's important to make it something that may last instead of kind of like, yeah, I'm gonna wash my hands. So this is something, be creative. I love the idea around have a different song every day. And Dr. Neela put in the box that maybe we'll have a new COVID dance move, you know, like get creative. And that's something, again, that can work across all age spans. Don't forget your teens and your tweens here. A lot of times people think, oh, they're fine. As Dr. Ebony mentioned, there's a lot of regressing now. That's the medical term for no matter what milestone you've reached, people like can go backwards. That's not just for toddlers. You can see some behavioral regression in your older kids too. So we want to remember to include these and apply these pearls for them. And then the third pearl Dr. Pam shared is use safe age-appropriate treatments. Again, that's something we want you to do all the time, especially now. Next, we are going to transition to Dr. Yvette. As much as we want all you to stay at home and be safe, sometimes that just doesn't happen. So Dr. Yvette, our emergency room doctor, is going to speak to you about what to do if this happens.
Hi, everybody. I'm Yvette McQueen, MD, emergency physician and travel doctor, a global physician on a mission to educate about health, travel wellness, and disease prevention. So first of all, I can't talk about my travel wellness because tip number one, stay at home. Okay. So if you stay at home, you actually may be saving a life. Think about that. Tip number two, I'm going to piggyback on Dr. Pam. So kids are still having things going on. They're outside, they're running around the house. We're having some interesting increase in jumping off of tables and couches. Think about fractures. We have people, teens trying to cook themselves and having some burns. So there are still emergencies that are happening. People getting things in their eye, different things. First of all, if you feel that your child is sick or have an emergency, have an accident, of course, call your pediatrician, as she said. The pediatrician office may be open and they can give you some guidelines of things you can do, because there's actually things you can do at home that people don't realize it for injuries. If the pediatrician office is not open, the second one you should try is an urgent care, particularly if it's not life-threatening. So if they're still breathing, they're not having chest pain, they're not persistently vomiting, and it's something what we would say a minor urgent care injury, call your urgent care, your nearest urgent care. So what urgent cares are doing right now is having you register either online or you go directly to the urgent care and you register with that app in your car. So to decrease exposure, a lot of them are not using waiting rooms anymore. They've removed their chairs. You register online, they give you a number, they call you and say, it's your turn, and they take you directly to the room and then take care of you, whatever you do. Urgent cares do have the simple things like some simple tests, x-rays and things like that. If your child, every parent should have a thermometer. And I know if you don't, they're hard to find right now, but every parent should have a thermometer. So when you say your child has a temperature, we as physicians decide a temperature is 100.5 degrees or 38 degrees Celsius. So that's 100.4 degrees or 38 degrees Celsius is considered a fever. Anything under that, we do not consider it a fever. So even if your child normally runs 97, you say it's 99, it's still not a fever. So if you feel, but the things you worry about, you like, have they been exposed to COVID? Of course, the guidelines these days for testing would be, have you had a fever? Have you had exposure? And are you having symptoms of shortness of breath? So tip number 3 is when to go to the emergency room. When to go to the emergency room is what we consider life-threatening, that you cannot do your daily activity that you normally can. Your child is consistently throwing up, and I'm talking about every hour they're throwing up. They threw up 12 times in the last 2 hours. They're going to get dehydrated. Please take them to the emergency room. If they can't breathe, you see they're gasping for air, their chest sinking in, they're getting pale. And she used the word lethargic. Let me explain what that term is. It's not like, oh, just I don't feel good. No, that's not lethargic. Lethargic is like, hey, I can't wake you up. Wake up. They're not responding. They're being incoherent. That's lethargic. That's the reason to go to the emergency room. Of course, like I said, they still have injuries, broken bones, abdominal pain. We still worry about appendicitis. But you guys tease through it. Like I just had a 6-year-old the other day that he's been having abdominal pain off and on every 2 or 3 days, abdominal pain, and then it went away. And after teasing through everything and discussing with a pediatrician, it was decided that most likely it's related to stress. And that goes back to Dr. Donna? Talk to your child about it. You know, he needed to talk about why he couldn't be with his classmates every day. So when you want to go to the emergency room, call them ahead. You know which emergency room, call them ahead. You can tell them it's not COVID related or coronavirus, whichever way you term is not related. It could just be, and they have areas of the emergency room that are not related to COVID. So a lot of people are telling me, I'm afraid to go to the emergency room. But we don't want you to die at your home for something that you need to really go to the emergency room for. So we're still seeing regular patients that's non-COVID. So I appreciate you. One, stay at home, please. No traveling right now. And talk to your children and call ahead either your pediatrician, urgent care, or your emergency room. And there are times when you will need to be admitted to the hospital, and I'll let the pediatric hospitalist tell you all about that. But since I am a wellness coach, I'm not going to give you guidelines about the emergency room. You can find some simple tips about Wellness 101 and how to incorporate it into your new daily life. And you can find that at thehealthyexplorers.com. Once again, thehealthyexplorers.com. Back to you.
Thanks, Dr. Yvette. Wonderful, wonderful information. Very important. You've heard a lot. We're going to say one more time, stay home. I like what Dr. Yvette said. It can help save a life. The other practical piece, because people have heard that and sometimes it's not quite getting to them, let's talk about common things being common. If you stay at home, there's a decrease. Well, there's no risk of car accidents. There's no risk of anything like slips and falls. There's no risk of any of that happening. So stay at home. And if you do need to go to, we want you to go in. If there's emergencies, call first. That's the one. Of course, if it's something that is obviously life-threatening, your child is not breathing at all, call 911. Do what you normally would do. For those things in between where you're like, this is serious, we think we need to go in, call urgent care, because I thought that was a wonderful tip. There is a step in between your pediatrician's office and an emergency room. That's urgent care, and these days they're really prepared for you. And even if you know it's going to end up at the emergency room, they obviously need stitches, for example, but they're doing okay, they're breathing. Call first to let them know, hey, my child was jumping off the table, looks like they're going to need some stitches, we're coming in. Call first, because these days it really is, it helps everyone to be prepared. So thank you, Dr. Yvette. And she already let you know who's coming next, Dr. Janine, our pediatric hospitalist, because in spite of our best efforts, sometimes children still end up in the hospital. Even if it's not illness related, babies are still being born, and they're being born at the hospital. So Dr. Janine. What do you want us to know?
Well, first of all, I am Dr. Janine, your board-certified pediatrician and old school mama who is on a mission to specifically help moms, first-time mom over age 35, and help them live their best parenting life. That's kind of my passion, but my actual gig is I am a pediatric hospitalist and have been for the past about 12 years. And what that means, a lot of people are like, what's a hospital? But it's actually just what the name implies. I just work with patients who are inpatients. A lot of hospitals and hospital systems have switched to where your regular pediatrician is not the person who sees you when you're in the hospital. So that what happens is in hospital, there's a particular group of doctors, and they actually see you while you're hospitalized. So they're hospitalists. So based on that, and this kind of piggybacks both on what Dr. Pam said and Dr. Yvette said, my first pearl would be, don't fear hospitalization if you need it.
Dr.
Because
you're breaking up a little bit.
Don't fear hospitalization if you need it. As both Dr. Pam and Dr. Yvette said, things are still, they're still happening. Patients are still having issues. There still are issues where patients actually do need to be hospitalized. Okay, let me do this. Let's switch, can we maybe switch to Dr. Neela, and let me switch to a different source just to see if I can get a better connection.
Okay, that sounds great. Thank you. And again, if anyone knows how to roll with it, parents and pediatricians, we know how to roll with it. So thank you, Dr. Janine. We know there's some storms going throughout the parts of the country. Plus, everyone, literally everyone and their mom these days is online. So we have some issues. So we're going to switch it up a little bit. I'm keeping with the theme of hospitals and children in hospitals. So Dr. Anila, a nurturing OBGYN, what would you like our parents and parents to know?
So thank you so very much. I'm so excited to be here. So it's a little bit of a swing. We're going to switch back to Dr. Janine and go back to Baby Central. I'm the chick who takes care of you before you drop your human. So we're going to talk about before you drop your human and then after you drop your human. So I am a board certified obstetrician gynecologist. I am a wife of 23 plus years, a mother of 3 children, speaker, author, all that good stuff. You don't need to know all my accolades. I empower my patients to live their best lives, body, mind, and spirit by helping them take charge of their own wellness. So here we go. 3 things. Someone mentioned earlier, I think it was Dr. Yvette that talked about urgent care. If you think that I'm off script because actually the thing I'm gonna give you at the end is not really this, but we're gonna talk about it as much as I can get in my little 7 minutes. So if you think you have signs and symptoms of labor and delivery, baby, don't go to the urgent care. Please and thank you, don't go to the urgent care because they can't take care of you. What's gonna happen is if you go to the urgent care, then they gonna call me because I'm an in-house hospitalist and say, we got a lady here that we think she is laboring. We're gonna put her in an ambulance and send her to you, right? Okay, yeah. If you broke something that don't have nothing to do with your uterus, by all means, go to the urgent care. But if not, go to the hospital that's closest to you that has the ability to be able to take care of you in case you're gonna drop your load. That wasn't one of my pearls, but that's just a sidebar. So the 3 pearls really are. The first is boo-boo. I know that your whole world has been turned upside down because you had a plan. Your sister was gonna come and cut the cord. Your mama was gonna be present and your husband was gonna be present for this delivery of this baby. And because of Corona, and because of the fact that there are people who have the disease that are asymptomatic and don't know it and they can spread it, now you can't have nobody visiting with you in the hospital, or if you do, you get one person to visit with you in the hospital. So this is the thing. As poopy as this is, and as much as it wasn't part of what you thought it was gonna go down, boo-boo, when life gives you lemons, turn it into lemonade, or like we like to call them lemon shake-ups. So you cut the lemon in half, drop it in some ice, put some sugar in it, some ice water, and shake, shake, shake. So instead, find out what your hospital's policy is regarding electronic media. So beforehand, the tendency before was that you couldn't videotape nothing and you really couldn't do any communication electronically beforehand. But having taken care of service members who were deployed in other parts of the world, talk to your doctor about whether or not they're cool with this. Most hospitals are actually bypassing standards with this to allow you to be able to make a virtual event, make it a virtual party. Make sure they don't let your hoo-hoo get involved in that, all that screen and that imagery, but turn your delivery experience into a virtual party. If you're going to use your phone, buy a stand, boo-boo. Amazon will still get it to you if you order it enough time to be able to get it done before your baby's supposed to drop. If not, there are, on the gift that I've got later on, there are a couple of apps that are listed. Depending on who your phone carrier is, what kind of phone you got, there are different apps that you can use or different services that you can subscribe to. Some have a little bit of a cost, some of them are free. But instead of focusing on what it is you've lost, flip it into something that's your gain. And with a virtual party, you can invite as many people as you want to electronically or as few people as you want to. So that's my first pearl. Pearl number one, turn it into a virtual party, your delivery plan, even though it's not going to go how you thought it was going to go in the beginning. Pearl number two is, okay, this is actually just backup for why you can bring your friends in with you to labor and delivery. At our hospital right now, we're allowing one person to come in, and that may change because somebody brought their COVID positive husband up into labor and delivery. He lied about having symptoms, set and was present for the birth of his son and was coughing while he was present for his delivery. And then afterwards, he told everybody that he knew he was COVID positive and he was COVID positive. Now, if you're a nurse that was pregnant and you were taking care of that lady, or any of the staff that were exposed that were treating you before until recently, now, when you go into labor and delivery, you will either be able to have one person once they've decided that you can be admitted, or no. All the nurses will be wearing masks because within the last couple of weeks, it is decided that with all your that you do when you have your human, that if you actually have the virus and you're asymptomatic, you can transmit it. So because of knuckleheads who have, effluvia where they think that it's their right to be able to do, which again, under normal non-pandemic circumstances, sure, bring your entire clan. Everybody should be able to come. But the trick is, because this virus spreads the way it spreads, and the people who are more likely to spread it are the ones that are asymptomatic, the sick people in the hospital, they ain't giving you nothing. They're just fighting for their lives. It's the folks that have mild symptoms or don't even know that they have the disease that are setting folks up. So this is why you can't have no friends with you when you come in, or only have one friend. So that's sort of pearl number two. Be prepared for that one too. That's why I told you to plan on the virtual event. And the pearl number three is, after you have this baby, we don't know what the coronavirus does to babies. What we do know is we're basing on what the flu has done. We know that the flu can put you at increased risk for having a child that has schizophrenia later on, because what viruses do is they infect cells and then make more copies of themselves and take over cells that are not infected. Kind of like non-virus states in our body, the same kind of process as cancer. So anyway, in women who are exposed to the flu at certain times in their pregnancy, it can actually change how the brain is made and how it functions later on. Because we don't know anything about this coronavirus, we are making assumptions about what other viruses have done in order to be able to get some ideas to what it could do. And so with all of that said, I know everybody's at home and they Netflix and chilling makes it so you have grown folks interactions more frequently than you do. And then because everybody's offices are shut down, if you didn't have birth control before, you might be in a little bit of a lurch now to get some. So the point is, don't get pregnant at this point. If you ain't already pregnant, you're already packing a person, wait until Corona has come and moved on before you get a human inside your personal space. Now, how do I do that? We said at the end, my little gift, there's some listings of, actually, there are listings for the other two things. What I actually plan to do is next Wednesday, 7 p.m. CST. I thought I had a video on contraception, but clearly as I check my reserves, I do not. So next Wednesday, 7 p.m. CST, I'm gonna talk to you about all the contraceptive options for you. The cheapest one for you right now, though, in all honesty, is if you don't have an allergy to spermicides, there's a lovely product. I'm not endorsing this thing. I don't have stock in it, but I can tell you she works. It's called vaginal contraceptive film. It's a little film by a little square. You peel it, sort of looks like a fruit roll-up, but real thin and clear. Tastes nasty, but she will work right nicely. She works nicely. She's about $9.99. You can order her offline. CVS carries it. Amazon carries it. But it's a way to be able to make it so that your babies come when you plan to. And when we have a better understanding as to what this thing does, since it's rolling like it's rolling, wait till it goes away before you conceive. So those are my pearls in a nutshell. 3.5, don't go to the urgent care unless you got a non-pregnant related reason. Make a birth plan that involves a video so that everybody can come to your virtual event party where you have your human human. This is why you can't have people to come in and use some birth control so that you don't get knocked up. And within that first 6 weeks after you have a human, I know many a patient that has fallen on a penis in that time frame from when they had a human coming out of their personal space to the time frame they saw their doctor, and you can get pregnant. Breastfeeding exclusively does not save you. You can get pregnant. So save yourself from having multiple people up in your personal space where you get Irish twins. Get the VCF if you're not allergic to it. Join me next Wednesday, 7 p.m. CST. We'll talk about all your contraceptive options and how your menstrual cycle works. And if you don't want to use contraception, you just want to use the rhythm method, we'll go through all that, because what I know, I want you to know so that you can plan your babies accordingly, and we can conceive in times where COVID ain't suggesting or threatening to make it so that you're flu puts you at risk for preterm labor. It can also put you at risk for pneumonia. We're assuming that the schizophrenia risk, the preterm labor, and the pneumonia, where you actually end up in the ICU intubated, we're assuming that COVID can do those same kinds of things, because it's new, we don't know. So enjoy your rides. Just be protective about not conceiving humans when you're catching a ride. That's all I got. Thanks. Bye.
Thank you, Dr. Anila. Thank you, thank you, thank you. I just love you. I love you.
Oh, my gift, sorry. bit.ly/pandemicpearls4.
Thank you. And remember, for people who came on, who are just joining us, all the different URLs we're giving will be emailed out to you afterwards. So we're putting some in the chat box, but don't worry. If you don't get it, it's going to be emailed out to you. Also, if you missed the beginning, one of our main driving forces for this event is that we're keeping it so that you can feel calm and uplifted afterwards, because one of the very first pearl we shared was that you set the tone in your home. So if you're feeling nervous and anxious, and we're not saying don't feel nervous and anxious, that's a big one. We're not talking about being in denial about it. Feel your feelings and move through it and support it. So if we have any mothers to be, any grandparents to be on here now, because we've been doing this a long time. I mean, I know I've been in the medicine for close to 30 years. All of us combined probably have a good 100 years of practice. So one thing we know is, as much as you've heard, there's probably some people who focus on the one thing Dr. Neela said is, oh my God, this could hurt my baby's brain. So what we want you to know is, that may be true. Don't focus on that. What we want you to do is stay calm, stay centered. If you're feeling nervous and anxious, feel that if you have a therapist, talk about that. If you have a good friend that you can just call and talk about your feelings, we want you to do that. If you journal, do all of that. And remember, in the beginning, we shared a nice diaphragmatic breathing, which is really important, because what it does is physiologically help you move from stress to calm. And if you are pregnant, one of the things we want you to do is to keep your nervous system calm. So that's very important. So, and again, the big takeaway was, please be very aware and intentional about your family planning. That's the big, big, big takeaway. I know it can be tough right now, but the last thing that we want is for people to have another stressor. And as much as we all love our children, let's be real, they are added stress. Stress isn't always a negative thing. Stress is anything you have to adapt to. So another human being that you have to take care of and clothe and feed, it's a stressor, especially if you didn't plan it. So that is the takeaway. Also, please be flexible. Please be flexible with your birthing plan. It's challenging, and we know you spend a lot of time into it. And you, like Dr. Neela said, you had the music and the drumming or whatever is your thing. That may not be the case, but if you turn into a virtual party and you get creative, kind of a throwback to what Dr. Pam said, have your sister, cousin, niece, best friend drumming on at home and while they're Skyping in. So this is a time that we have to be flexible. And again, that's a skill that we always want our children to learn. Yes, right? Yeah, we want our children to be flexible and adaptable. So now we all are having a crash course in doing that and modeling it for them. So with that said, now speaking of being flexible and adaptable, Dr. Janine is back, and she was able to adjust because we know technology happens. So thank you, Dr. Janine. Unmute yourself when you get a chance, and
okay.
let's start at the beginning. Up right when you were giving your pearls.
Okay, can you hear me okay now?
Perfect.
Okay, so I won't go, I'll just real quick on my introduction. I'm going sure how much of that got through, but I'm a board certified pediatrician. I also have a passion for working with first-time moms over the age of 35, helping them bring out their best parenting life. But like I said, I'm a pediatric hospitalist, which for a lot of people is something they haven't heard of before. But over the past year, probably about 10 to 20 years, a lot of the trend has gone towards like your regular pediatrician not seeing you in the hospital. They've kind of turned over services, and they do some adult medicine a lot too, to people who are kind of specialists in caring for children when they're hospitalized. So, kind of to echo what both Dr. Yvette and Dr. Pam said, my first pearl is don't fear hospitalization if you need it. I know everybody kind of is like, you know, if you're watching the news, it is very stressful to look at the news and see all these people in the hospital and see people dying and see people, you know, body bags and all of these things that make you go, maybe I shouldn't take my child to the hospital. But kind of like Dr. Yvette said, regular things still happen. Kids are still breaking bones. Kids are still needing their appendix taken out. Newborns still have fevers and need to be hospitalized to prevent what we call sepsis in that age group because they're very prone to that. These things all still happen. So you do need to, if your child, after you talk to your pediatrician and they say, no, that's something that you need to go to the ER for and possibly need to be admitted for, do not be afraid to go to the hospital. Hospitals now are taking such care and concern to prevent any contamination or exposure to COVID patients, particularly with pediatric and neonatal patients. Most hospitals are doing a really good job of trying to keep those patients away from the COVID patients. So don't freak out if your child really does have to be hospitalized. Second pearl, kind of with that though, realize that your hospital experience may be very different than it was before COVID-19. I know Dr. Anila kind of touched on this with numbers of people that are allowed to visit with women who are in labor, but this is also an issue with hospitalized children as well. A lot of hospitals, and you have to kind of check with the hospital because a lot of hospitals have different policies, but a lot of hospitals have eliminated no children are allowed to visit hospitals pretty much now. That's kind of what the standard is set. So, you know, if your 10-year-old is hospitalized because she needs her appendix out, your 12-year-old will not be allowed to visit your 10-year-old. They will have to see them when they come home. Most hospitals have pretty much cut visitors for anyone under the age of 18. So you will have no extra visitors. The other things, now most hospitals will still allow some hospitals 2 parents, but a lot of hospitals are switching to just 1 parent to stay with the child. And again, kind of like Dr. Anila said with women who are in labor, usually most hospitals are requiring that 1 person stay with them the whole time. They stay in the room with the patient. So your experience is going to be a little bit different. You're not going to be going back and forth to the gift shop or doing things like this that you might otherwise be doing to kind of keep your kid entertained and amused in the hospital, and you can't go in and out a lot because a lot of hospitals just aren't allowing that. So just manage expectations because your hospital experience is going to be different. And also for that, just thinking about your children, particularly for younger children, you kind of have to prepare them that things are going to look different in the hospital. It might be a little scary, particularly if you have a younger child. Everyone is in, you know, the N95 mask, and a lot of people are gowned up and they have their hair covered all day. And because that's just kind of the standard that people are being very careful about how transmitting things in the hospital. So doctors, nurses, respiratory therapists, everyone's wearing their PPE, their personal protective equipment, which honestly, particularly when you have young ones, that's very scary. I mean, they look at that and they kind of don't really know what they're dealing with. So just trying to kind of let them know why they're their nurse or doctor and why you can't see their face and why they may be dressed differently, explaining that to young children so that there's not that extra layer of fear that occurs. So yeah, manage the expectations because your hospital experience might look differently. And then the third point, actually, and this kind of piggybacks also with what Dr. Anila was saying. It would have been a nice lead into what you said. But newborns. In our hospital team takes care of babies from the time that they're born. Actually, we attend deliveries because we see infants in like C-section deliveries or if there are issues. And then we take care of newborns right after they're born. So for brand new moms with this new infant, and I've heard a lot of fear and they're wanting to get out of the hospital as soon as possible. And a lot of hospitals have adjusted their policies a little bit. So if you have a regular, healthy vaginal delivery, a lot of hospitals now are sending mom and baby home because they don't want to have that risk of them catching anything or being exposed to anything as soon as possible, keeping with their health. So a lot of times if you have a normal, uncomplicated vaginal delivery, you might go home right at 24, 25 hours. Even some uncomplicated C-sections or repeat C-sections that you're not having a lot of issues from, we're seeing some of those moms discharged even as early as 36 to 48 hours. So just realize that even with a new baby, there are going to be some different policies and procedures in place, and keep that in mind. And now the most common question that I get for brand new parents when I see them in the hospital is, what should I do differently? You know, now that this COVID-19 is going around, what should I do differently? Honestly, my answer to them is pretty much the same. I always tell parents, you really shouldn't, even before COVID-19, you really shouldn't have anybody around your newborn in the first 6 weeks anyway. Babies' immune system don't really function that well. They are kind of just learning how to do things. Breastfeeding helps with that. They get some of mom's antibodies. But basically their immune system it's learning. So their immune system is weak. They are at risk for more things. So in general, you definitely want to watch who your newborn is around. You want to make sure that you keep that baby in the house. I mean, but we should all be staying in the house, but definitely if you have a brand new baby, not only do you keep that baby in the house, but please don't let anybody else in the house either. I don't care if it is family, grandma, all of that. Let's just let that first 6 weeks go with just you and the baby. Let's not do any unnecessary risk, because as I said, and this is what I explained to my parents, anytime a brand new baby in the first 60 days, particularly and definitely the first 30 days, any baby with a fever is an automatic readmission to the hospital. And it's like a 48-hour readmission to the hospital. They're going to do everything. They're going to do chest X-ray. They're going to do a spinal tap. They're going to do a catheterization for urine. It's not a fun thing. So you definitely do not want to put your newborn, especially your under 30-day-old newborn, at risk for having to do all that, because they're going to do all these tests, and then they're going to keep you in the hospital for at least a minimum of 48 hours on IV antibiotics. So nobody wants that to happen. So as much as possible, make sure you really protect your newborn. Everybody should be staying home, but definitely have everyone be very just overzealous about hand washing and hygiene to make sure that the newborn isn't exposed. So those are my 3 pearls. Don't fear the hospital if you do actually need it. The hospital experience may be different, and definitely take extra special care with your newborns. Now, I actually also do have a little hint. My little thing is a little long, so I'm just going to stick it in the chat, but it's I have like 5 pandemic parenting hacks for success. So just kind of 5 little help the pandemic that are going to kind of help parents feel like they have like a little more supported. So that's it. Back to you, Dr. Donna.
Thank you, Dr. Janine. Thank you, everyone. So how was this? We're at the top of the hour, just about. As we promised at the beginning, we are keeping this short and sweet. We know that your time is precious, and even though everyone is sheltering at home, for parents, some of you may be actually busier than you were before. So we do want to give you a few minutes to ask some questions. So if you have anything that's pressing, please put it in the Q&A box. If you're watching this on a laptop, that'll be at the bottom. If you're watching it on a tablet or on your phone, you might have to scroll. You can also, let's go ahead and put it in the chat. We've given you contact information, and they'll be emailed out to you. So if you have questions, you can find us online. We are very easy to find. Google us, search, find us usually by Dr. first name. Most of us you can find if you put in Dr. Pam, Dr. Donna, Dr. Yvette, Dr. Neela, Dr. Ebony, Dr. Janine, you will likely find us across social media. So you will have many different ways if a question comes afterwards.
So I have a question that Jennifer put in a while back. She said her son just bought some over-the-counter meds for her 3-year-old grandson. Does she hold off administering it if needed? And so I told her, yes, to read the label. So if it's something like a homeopathic medicine, something that's natural, it might say for kids whatever age. But if it says for 6 and over, no. So always read the label, all right? So if it's something that's not good for a 3-year-old, don't do it. Don't do it. Just look at my list. Don't do it.
And I'm going to add to that, Dr. Pam, that dealing with the over-the-counter medicine, some of them will be like cough suppressants. The only one that I know that is natural is Zarbee's, that you can give to kids under 6. That's the only organic natural one that I know. But once again, wait a minute, I don't know. That's the only one I know. I'm telling from a grandma point. I'm sure there are other ones. But if he bought that, but if it's not that, if it's the triaminic or anything, no, don't give it. And also be careful. Dr. Pam mentioned it before. If the child is under 1, they should not have anything that has honey in it. Do not give honey to a child under 1 year old.
Yeah.
So yeah, what I was saying was there's a homeopathic medicine called Chestol that's by Boron, and it's got honey in it. So once again, you can't give it for kids, under 1. However, there is I'm just going to show y'all briefly. There's a homeopathic medicine called Colcom. This particular one is indicated for kids 6 months and up. Wow, it's actually, pediatrician approved. It's safe for kids 6 months and up. There's not many meds like that. So, you'll get a list of some of these things when you get my little drpam.gift. So have no fear. It'll be there.
Thank you, Dr. Pam, Dr. Yvette. We're going to say this one more time about the honey. We're going to give a broader teaching lesson here. Not natural doesn't necessarily mean safe. We could do a complete webinar on that. So the big takeaway is don't give honey to children under 12 months. Short version is it has botulinum toxin in it. You've heard of botulism. So we don't want to have our children exposed to that. We have one other question that came in that we're going to take before we turn off. I think few of us might want to chime in. This feels like a Dr. Ebony question. It's from Lucille. Her question is, do you have any tips for keeping peace between siblings? And that's in general, but Lucille has a big age range. So
yes, that's, when it's a big age range like that, it can be difficult because, it's hard to just put on a show or something that all of them can enjoy at the same time. But what I will say is really trying to stick to a routine still is going to help. And say, for instance, there's a specific toy or device that they're fighting over. If you can set a timer and give each of them a specific amount of time for that device, that helps. The other thing I'll say is, we're all at home, but it's super important to give that one-on-one time to each individual child. That's obviously hard to do when you have more than one, but even if it's 3 minutes, 5 minutes, if it's something your child can pick where it's just mommy and this kiddo's time, it works wonders. And you call it something special like mommy baby time, and they can look forward to that. And if they're fighting with each other, just remember, we have mommy and baby time at 6, and so as soon as we do that, you know, when they feel like they have your undivided attention, they don't have to share you with the other kids. It helps. The other thing is sometimes they're fighting with each other to do stuff to get your attention. And so if you offer your attention at times when they're being good or not, you know, getting into it with each other, it helps. And so sometimes they'll do negative stuff just to get your attention. So giving extra hugs, cuddles, having that one-on-one time really, really helps.
Thank you, Dr. Ebony. I want to add one of the things we talked about in the beginning, which was you set the tone for everyone in the house. That's going to be really important because sometimes kids will be kids, but especially sometimes kids are like the emotional pop-off valve. So if there's a lot of tension and anxiety, they may you may see them fighting it out or acting it out amongst each other. I also want to offer that when you have older kids, and 11's not old, you have the tweens and the teens, sometimes we are not as patient with them. That was another pearl. This is an incredibly difficult time. It is a traumatic, and literally a traumatic time for many people. Trauma means a scar, emotional scar. Trauma, if you want to get technical, really looks at if there's a fear of injury or death. So older kids may be truly experiencing traumas that they're not talking to you about, and they may be acting it out. So we do want to remember to be patient with our older kids. Many times when we have little ones and older ones, it's very quick to say, well, you know better, you're the older one. So we have to be very patient with them and also check in with them and give them age-appropriate tools. Sometimes appealing to their sense of being older can help. Other times it can't, and that could be another talk. We don't want to parentify the older kids, but if there's a way that you can appeal to their sense of wanting to nurture and be kind of a caregiver for the little younger ones, that can help. But if they're just not feeling that, then maybe don't put that on them. Some of the stress management skills, and there's so many online videos and home meditations. These are times where we can do skill building for the family, and there are some relaxation things that you can do that may be age appropriate across a wide range. There's also crafts that you can do so you can get creative. Back to an earlier tip. Get creative with what we can do. This is a great time to get back to family time and find some common goals that everyone likes. You know, and even sometimes picking what that task is can be a thing. You know, in other words, like the goal may not be to get to playing Monopoly. The goal may be to have a 30-minute discussion to have the kids to try to figure out what they're going to do. So you just have to be creative in what we're doing to have them work together, because we are now we're always modeling behaviors for our children. Now more than ever, we're modeling behaviors for them. So please remember that. Be patient with your teens and your tweens because they're having a tough time too. Hope was that helpful? Okay. We are winding down now. We know it's bedtime for many parents. Thank you so much for joining us. If you enjoyed this, tell your friends, follow us across social media. Remember to claim all the gifts that we sent out. There's a lot more resources because we covered, even though we kept it as short and sweet, we covered a lot in an hour. Thank you so much. Please stay home if you can. Be safe, be well. And when you finish this, think about, if you remember 1 or 2 pearls, please take them, jot them down. Don't stress out trying to remember them all. If you have 1 or 2 pearls, use them, enjoy them. We love you. We appreciate you. Thank you. Be well.
Bye.
Bye.